World Glaucoma Week. Have you had your eyes checked?
Glaucoma is a condition in which the nerves of the eyes are slowly damaged, mostly because the pressure inside the eye is at a high level. So slowly by slowly that pressure compresses or presses on the nerve and slowly damages it until it reaches a point, if not controlled, the patient can go blind or have very reduced vision. Basically, the management of glaucoma will involve lowering the pressure of the eye to a low level such that the eye operates within a low pressure. So that pressure can be lowered by either using eye drops or using laser treatment or using surgery.
I'm Dr. Mondia. I'm a pediatric ophthalmologist. That means ophthalmologist first, but a doctor of eyes, and then subspecialist in pediatrics, meaning I do more of specialist in diseases to do with eyes in children. This is Brighton. Brighton was brought to us 3 months ago, November, and the mother noted that one eye is bigger than the other one, and the child was always tearing with the one eye and very sensitive to light, and so she was concerned, and then she came to us. After examination, we diagnosed glaucoma in the right eye. So this is a case of unilateral glaucoma, where usually they affected both of them, but in this case it was in the right eye.
He was 3 months by then. We came at where we stay, Nyamuru, Nyandarua. We were now referred here like a week. After tumeenda kuona huyo daktari in a week, ndio tukareview the best treatment na kanywangu hapa, tukarifadiwa hapa.
It's usually very insidious. I mean, it's not very obvious at the beginning. In the beginning, once they are born, and this is a bit funny, is that when they are born, most patients, especially when it is bilateral, a lot of parents think they are beautiful, big eyes. So even the relatives who come to visit them or friends who come to visit them usually will comment, your child has big eyes, very beautiful eyes, and sometimes they may turn a bit blue before they become very hazy and white. So this is a very confusing period for the mother, because big eyes, of course, to us are good, beautiful, and blue eyes probably is like, oh, what beautiful blue eyes, until the child starts now tearing or producing a lot of tears, and they cannot stand light, and the mother is worried that these beautiful big blue eyes, the child cannot stand light, and that now probably brings the mother to us, that the child cannot stand light and cannot is tearing a lot.
Mara nyingi watu kipata mgonjwa hapa kwetu kwa macho, na kama ni mara yake ya kwanza, lazima tumuelezee ile shida ako nayo, kwa sababu pressure ya macho huwa inaanza polepole. Na mara nyingine huwa usikii uchungu ikianza. Sawa sawa. Ile wakati utakuja kujua pressure imeumiza macho, ni ile wakati kiwango yako ya kuona imeanza kwenda chini. Sawa sawa. Wengine huwa wanakuja hospitali kama kiwango ya kuona imeenda chini sana. Na mara nyingine unapata matibabu yao inakuwa kidogo, kwa sababu nguvu ile daktari, kiwango yenye daktari anataka arudishe ile vision yake kuona, inakuwa ni vigumu. My name is Ruth Kerubo. I am a nurse in Kikuyu Eye Unit. Glaucoma doesn't affect elderly patients only. It affects all patients, including babies, infants, to elderly patients. It affects male and female patients also. Patients come at early stages and other patients come at end stages. when the glaucoma has already affected the nerve and there's no much intervention that is normally done. Normally, we send patients to the low vision for management with glaucoma, because the earlier you take that patient and you talk to that patient, you expect the management will be better, because the patient will understand the problem and now the management will be easier.
Boesha hivyo, I need to understand whether and realize that light is on or off. So that's very important for us, because meaning kuna some light perception, and if a child has a light perception, that is very, very important. Like this is color green, this is yellow, and there's some red. So when it flickers like that, it is very interesting for the baby. So it's inakuwa na interest ya for the baby kuangalia. So that looking at the light, it is very important for us.
My name is Amelia Njeri Washira, and I work at PCA Kikuyu Hospital, a unit, low vision department. I work as a vision therapist. Person with low vision is a person who is not sighted and then he is not able to see all. The vision is not completely gone. With low vision, and especially like the people with various conditions, one of it is glaucoma. First, and the most important thing is the person to be seen by the doctor or ophthalmologist to make sure that they have been done or what is supposed to be done. For example, if a person has to use the drops or he has to be done operation, that is done. And if the person has to be probably done what we call refraction to measure whether he requires glasses or not, that is already done. So every medical intervention that is supposed to be done is already done. So by the time the person is coming to our clinic, we have every information that we need to know from a doctor point of view. So we know that probably this is where the patient is, especially patient with glaucoma. We need to know first of all whether they have been done their visual field. That is, the visual field is in layman language, if I use it, is quality of sight. One of the challenges that we face is that when the patient comes, sometimes the patient they still have the emotion and the psychologically they are not stable, because they are coming from a world that they were seeing and now they are not seeing, and they have been told there is nothing much to be done. So you see, when they are told nil to do, to a patient that information is too hard to pick or to really put and to digest. There is that fear, and we want now to, first of all, to make sure that the patient really understand there is something we can do. So we need to start the counseling process, go through the counseling process with the patient, because first of all, you have to stabilize this patient. We have to let the patient understand, okay, fine, I have no vision, but I can live a normal life. There's much to be done to make me back to what I was. Even though I'm not going to use my vision, there are some other ways that I can use to be able to continue in my normal and my daily activities. So before you now start working on this patient, you have to go through the counseling process for the patient to get to a point where now they come to a point where they accept their condition. And it is a process that sometimes it can take a bit of time, a period of time, so that the patient now accepts to be rehabilitated. even when you have come, and probably you have come when it's too late, the vision is so much reduced and you cannot see well and you cannot do your daily activities, there is a lot of hope. Because for us as vision therapists, what we do, we have to carry out what we call functional vision assessment, where we need to look at various areas and how you can see and the vision that you have. And then there are ways we can help you to read again. For example, if the vision is reduced to an extent that you used to do a lot of reading and you cannot read, we do what we call optical vision assessment, and there are special gadgets that we can help you to use to be able to read again. If you cannot be able to read again and you see you cannot use the gadget or your vision again to read, there is a way, because there is Braille for the people who are not sighted, who cannot see well. They use Braille to go back to the normal running. Like if your child is in school or when an adult was doing his work, you can train on Braille, and there is talking computer. So there is much we can do. And then of course, because number one problem that the patient will find in the fear is orientation and mobility, moving from one point to another or knowing where you are in terms of environment. So we do what we call orientation and mobility. We train on use of white cane, so you can be able to mobilize even when you don't have somebody to help you to move. Once we have rehabilitated you and you are trained on how to use a white cane, you go back to independence. You can be able now to work without guide. You can be able to do a lot of things by yourself.
Naitwa Eva Wanjiru. Mimi ni patient wa glaucoma. Actually, journey yangu imekuwa too long sana, lakini bado still nang'ang'ana. Glaucoma yangu nilipotea macho nikiwa 4 years. By that time nilikuwa kwanza navaa miwani. Miwani ikafika pahali ikakataa. So nikakuja kurealize that ni glaucoma inanikula macho. But since that day nilikuja Kikuyu Hospital na nikashughulikiwa na madaktari, na nilipo join class 5 macho sasa ndio ikapotea kabisa completely, nikakuwa totally blind. Hiyo safari imekuwa hard sana, but nimekuwa niking'ang'ana kutoka class 5 hadi high school nikamaliza. Since hapo nikaenda college nikasomea kitu tunaita massage reflexology, bado tu nikiwa na disability ya glaucoma na kuwa totally blind. Hakuna kazi sifanyangi. I normally do everything. I wash, I cook, na napenda usafi sana. Na zaidi ya yote cha muhimu ni kufuatilia maagizo ya daktari.
Wale wako nyumbani wakiwa na glaucoma hii, naweza himiza hao wajaribu sana kwenda kwa daktari kabla ya hii macho kupotea kabisa. Na wakienda kwa daktari wafuate maagizo ya daktari very properly ili macho yao isipotee.
The age most commonly affected by glaucoma, it's usually the people in the senior age group, but in Africans, glaucoma comes at an earlier age. So from around the age of 40, you start seeing glaucoma. So it's advisable to screen for glaucoma from 35 years onwards.
Yule mtu ambaye akona disability ya glaucoma, ningependa ku-encourage siku ya leo, msiweze ku-give up. Mzidi kufuatilia maagizo, na hata kama mtu ajui akona glaucoma ni vyema kwenda hospitali. Na hospitali ni ambaye inaitwa Kikuyu Hospital, kwa sababu mimi huko ndiko nilianza kliniki zangu, na saizi niko vizuri, naendelea vizuri.
The aim of rehabilitation, it is to improve the daily lives of people with visual impairment. So we are here to increase
or to improve, whether they are totally blind, as we said, they cannot see at all, or whether they are low vision. We have to improve their vision to help them to be integrated and live a normal life like any other person.
This message is brought to you by PCA Kikuyu Hospital in collaboration with CBM.